Hi, my name's Natalie. We're going to do your head-to-toe assessment. Can you verify your name and date of birth?
Leslie Pichardo, 0402-2004.
Awesome. And then can you tell me the date and and where you're at?
December 12th, 2025 in Chicago.
Perfect. And then I'm just going to do a head-to-toe assessment. I want to feel here just your skin and circulation. If you uncross, thank you. And then say toes. Good. Awesome. Okay. So I see that your skin is warm, moist, pink, and I don't see any clubbing on your fingers, and your cap refills look really good. So we're just going to go on a head-to-toe sequence. I'm going to start with your head. All right, let me know if there's any tenderness here when I palpate. Okay. No? No pain?
No.
Okay. Good. And hair distribution. Just gonna pass it here. And then move side to side your jaws. And then push it out. Good. Now I'm gonna put a little bit more resistance. Go ahead. Good. And then push it out. Good. Okay. And then any pressure here? None?
No.
Okay, good. All right, so I'm just gonna look at your external eye structures right now. I see your eyebrows they're symmetrical and they're evenly distributed. Your eyelashes are also evenly distributed. I don't see any swelling or punctuosis on your eyelids. Your lid margins look good. No signs of any swelling. Can you pull down your conjunctiva for me? With respect to grandma. All right, so now what we're going to do is I'm going to have you stand up and we're going to assess your walking and your balance.
Now
okay?
I'm going to have you close your eyes for
if
me,
you
and you're going to let me know if you can feel it
just
on
up your
each
side.
side.
Perfect,
Okay?
just like that. Close your eyes. Good. I want to make sure that you're not toppling
Feels the same?
over.
Okay.
All right, so
Now
what I'm going to have you do is I'm going to have you take a few steps forward.
Awesome. Good.
Just
And then
kind of
can you
regular
lift your
normal
eyebrows
steps.
and
Okay,
frown
now when
for
you
me?
come back, do like
And
heel to
then,
toe, like if you're doing
hold out
like
your
a drum
cheeks.
test. There you
And
go.
smile and show me your teeth.
Perfect. And then
Good.
walk on your
All right,
heels.
thank you.
And walk on your.
I told you about your externals.
Perfect.
Your eye structures.
Good.
Now I'm going to take
All
a
right.
look
Now you
at
can face me.
your
And then if you
your
can
internal
kind
eye
of
structures.
bend
okay?
your
So I'm going to
hyperextend. Good. You can put your hands on here.
Okay,
for
so
support.
now I'm going to have you
and then you can also
look
like
at my
have like a
nose.
shoulder
And then I'm
stand.
just going to shine this
Good.
light.
And then kind of like
Good.
move from side to
And so
side.
that the light is equal. on
Okay,
both
so
sides.
now I want your
Okay,
hands
so
flat,
now
like
I'm
this,
going to have
and
you,
then kind of
before
reach
we
over
go into your internal
to the
structures,
side. Good.
I'm
And
going to
then
have you
over.
follow
Good. And try to keep that
the
back
pen light,
straight.
okay?
And
So
now I'm gonna have you bend forward, but try to keep your knees extended. Okay. So go ahead, bend forward. Awesome. And then look here, and then look at the clock over there. Perfect. Okay. Now, I'm going to do. I guess we could do your. I'm gonna turn down the lights, and then we'll do the pupils response, and then we'll turn off the lights. I just want to see what your pupils do. You can stay looking directly at me. You have such big eyes. Okay, good. Now I want to see what your other eye does in response to light. Good. Perfect. Awesome. Okay, now I'm gonna look at this now that I can see it here. Perfect. Light shines directly on each side. So what we're gonna do now is I'm gonna look at your internal structures with this light. It's gonna be a little bright, so I apologize, and let me know if you need a break, okay?
Okay.
All right, so I'm just gonna go in and see your red reflex. Look directly at that clock right there, and just keep staring at it as much as possible. Okay. Good. All right, so I can see your red reflex. I'm just gonna go in, and I see your retinal background. It's orange and red. I see your clear vessels with clear branching. Then I see your yellow optic disc. And then take a look at this for me. Perfect. And then this is a darker border. And that is your macula. Good. Now I'm going to go on this other side. All right, so same thing. A little bright. I just want to find your red reflex first. good. And then I'm gonna follow it in. All right, and then I see your retinal background is orange and red. I see your vessel is clear branching. I'm sorry. Clear branching. Then I see your optic disc is yellow. And then take a look at this light for me. I know it's bright. And then your macula is dark gray compared to surrounding retina. Awesome. Good. Okay. Now I'm going to turn on the lights so they're not. Okay. All right. Sorry. I know that was super bright. Okay. So now we're going to do your peripheral vision test. So what we're going to do is I want you to cover a side of your eyes, and then you're going to tell me when we see the fingers together, basically. Okay. All right. So you're going to let me know when you see my fingers, okay? Oh, wait. Look directly at my nose.
Okay. See them? I see them. I see them. I see them.
Okay. Now switch. Let me do this. Oh, there you go. All right. Let me know when you see it. Oh, look directly at my nose. Okay, go ahead.
I see them. I see them. I see them. I see them.
Good. Okay. Awesome. All right. And then we did this one. Good job. Okay. So now we're going to do your ears. I will inspect your, oh, I'm so sorry. I will hear some any tenderness here when I feel it.
No.
Okay, so I see that your auricles are symmetrical, appropriate position, no tenderness in your tragus. And then I'm just gonna go in with an otoscope. So I'm just gonna pull it up and back. All right, so I see here, holding it like a pen, that it's clear canal with your tympanic membrane is pearly gray. I see your bony structures, landmarks, the cones of light, no redness, no polyps, or any discharges. And then your tympanic membrane is intact here. All right, so up, back. Good. Clear your canal. Tympanic membrane also pearly gray and translucent. It's intact. No perforations, no body clear structures as well. No redness, no sign of infection. Good, thank you. Whisper 3 words, and then you're going to let me know what those 3 words that you hear, okay? Okay, so cover the ear that we're not testing, so the opposite one. The other one. Thank you. Okay. Red dog cat.
Red dog cat.
Okay, next one. Yellow, red dog.
Yellow red dog.
Okay, good. All right. So now what I'm gonna do is I'm just gonna compare these the hearing times that you can let me know when you stop hearing them. Okay. So here is a timer. On your masseter muscle. Okay.
Okay.
Okay. Let me know when you stop hearing it.
Stop hearing it.
Okay.
Stop hearing it.
Okay. Wait, no time.
Stop hearing it.
Okay.
Stop hearing it.
Good. All right. So that's the 2-to-1 ratio. If you had any hearing deficits, that's how you would tell where it would be at. Okay, cool. Now I'm gonna do this where you're gonna tell me if you can hear it on both sides. Okay. Okay, so lateralize on both sides. Awesome. Just tilt your head back for me. Good. All right, so your nasal mucosa is pink. Your septum is midline and intact. Your turbinates are also pink, non-boggy. They glisten. No abnormal discharges. And then can you plug in your and take a deep breath? Okay, maybe one. Any trouble with that?
No.
Okay, good. All right, so I see that your lips are pink, non-chapped. The borders look good. Can you open wide for me? Good. So I'm just gonna take a look here. So your mucosa is pink, no lesions. I'm gonna take a look at your gums. Good, no swelling. Teeth are in good condition, no obvious. Okay, good. So I want to take you to take a sip of water, and then when you're done, say ah, okay?
Okay.
Good. So I see your uvea rise midline appropriately. Lift up your tongue for me. Good. Nice and soft, no lesions, good vasculature. And then push it down. And then your hard palate is pink and intact. Okay, and then can you move your tongue up, down, side to side? Okay, good. And then I can see that when you talk to me, your articulation is good. Okay, awesome. Thank you. All right, now we're going to take a look at your throat. I'm going to have you swallow a few times, but first I just want to inspect it. I see no masses or deformities or any lesions. Just feel here. Any tenderness when I feel here? Okay, good. All right, so I want you to swallow for me, and then I'm just going to... Okay, awesome. And then I want to check your thyroid. A lot of the times you can't really feel it, so it's not a bad thing if I can't. Okay, go ahead, take a swallow. We're going to compare the right and left side. Sorry. Okay, go ahead. Good. Now the next one. Good. Okay, awesome. So I don't feel any thyroid enlargements or any normal structures here. Perfect. Okay, cool. Now if you're going, I'm going to feel your lymph nodes. I'm kind of go around from the back all the way to the top. I mean, kind of like to the top here, and then we're going to go down to your neck, okay?
Okay.
All right, so I'm going to see your occipitals, and I'm just going to kind of rotate lightly and then a little deep, okay? So your post-auriculus, preauriculus, insulars, submandibles, submental, over here, posterior, and subclavicular. Okay, I didn't feel anything. Was there tenderness anywhere?
No.
Okay, good. And then I am going to have you, we're going to inspect your posterior now, so we'll have you kind of just watch your back, and we're going to have you take this off too, okay?
Okay.
All right, can I come back in?
Mm-hmm.
Okay, good. So I say take this off. So now that I can just have a better inspection here, so I'm going to have you hold your breath for me, and I'm just going to take a listen here right before we do all this. Okay. So take a deep breath and hold it. Okay, now let go. And I'm going to go around, do it again. Ready? Go ahead. Okay, good. I don't hear any bruise. All right, so now I'm just going to take this down. And I'll put your hair to the side. Put some hand sanitizer again. Okay. So I see here, if you want to come back around, no masses, tenderness. Do you any tenderness when I Okay, cool.
No.
All right, and I'm just gonna unclip this. I'm sorry. Okay, so I see your spinal process is midline. Okay, so I'm just going to percuss now. So, or actually, no, I'll do tactile formitis first, but I think I'm going to do it where I'm going to have you just turn around. Let's do this way. Perfect. Okay, so I am going to, actually, can you take one step forward for me? Perfect, thank you. All right, so I'm just going to kind of karate chop you out a few places, and then you're going to tell me 99. I'm going to say 99, and then you're going to say 99. I'm so sorry.
Okay.
All right, thank you. We're going to do this. So I'm going to say, you're going to say 99. I'm going to kind of karate chop you in a few places. So repeat 99 about like 3 or 4 times, okay?
Okay.
All right, go ahead.
99, 99, 99, 99.
Okay, hold on. So when I karate chop you, then say 99.
Oh, okay, okay.
Okay, ready?
Mm-hmm.
Go ahead.
99, 99, 99.
Good. All right, so now I'm going to percuss. It's a little funny, but it's just gonna hear the difference in location.
Okay.
Good. All right. And then any tenderness here?
No.
How about there?
No.
Okay. And then can you take a deep breath for me? Good. All right. So this is symmetrical here. Now I'm going to have you sit back. And we're going to inspect the anterior side of your chest now. Please let me know if there's anything uncomfortable. All right, so symmetrical, no distress. We're going to do the same thing, so I'm going to go ahead.
99.
Thank you, sorry. All right, and then I'm going to percuss here. And this is a little I'm sorry. Okay, perfect. Thank you. All right, so now I'm gonna just take a listen to the back of your heart sounds. Your lung sounds. Okay.
Okay.
All right. And then you just keep breathing normally.
Okay.
And be listening to about 12 spots. Take a deep breath for me. Good. And one more. Perfect. All right. Now I'm going to take a listen to your fronts of the lungs, okay? And then we'll move on to the heart.
Okay.
All right. I'm going to bring this down again. Take deep breaths for me. Good. One more. Awesome. Thank you. All right. All right. So thank you. Now I'm going to just look at your, palpate your lymph nodes on the inner sides, and then we'll have you lay down and we're going to assess your cardiac and kind of like the internal structures or like, I guess, the external structures of your. Okay, good. Now what we're going to do is I'm going to just check your lymph nodes on the inner kind of arms up until your axilla. Then we'll have you lay down and we're going to kind of assess your anterior thorax and your cardiac, okay? Okay, so if you could just kind of relax your arms here. Just going to palpate. Okay, any tenderness?
No.
All right. Any tenderness here?
No.
Okay. Awesome. All right, so if you can lay flat for me, let's put grandma's, yeah, there you go. Let's put grandma's pillow there. Lay. Beautiful. Sorry, I know it's cold. Okay. All right, so I'm just going to be looking at, I'm going to have you a little bit flat. I'm sorry. Go ahead. I'm so sorry. Okay, so I'm just going to be looking at your thorax. I'm going to cover you when I inspect this. All right, so I'm just looking at any, all right. So I'm just looking for any kind of heaves, lifts, or anything, and then I can feel your apical impulse right where it's supposed to be. To go here. Perfect. I'm gonna put this down, okay?
Okay.
Thank you. Perfect. I'll put this here. And good. Kind of like I said, everything still looks symmetrical here. I'm gonna take a listen to your heart, okay?
Okay.
And we'll do it with both sides of my stethoscope. So. All right. We're gonna go here, second spot. We're gonna go through your aorta. Swing it across. Chronic. Bring it down. Mitral. Good. And then your apex. Awesome. All right. Now I'm going to do it with the other side of the stethoscope, okay? Sometimes you can hear things better. So same thing. Second spot, aorta. Bring it across. Awesome. Okay, perfect. Good. You have a slow heart rate. All right, now I'm going to have you sit up, and I just want to see if there's any distension on your veins. Okay, whoa, slow.
Oh.
Okay, good. I didn't see any. Beautiful. All right, so now I'm going to have you lay back down, though, and you're going to face to the left, so face this way. Perfect. And then I'm going to take a listen to that apical impulse again. Okay, so it's kind of like the loudest part that I could hear you. So I'm going to find this entrance of your gown. And then tilt forward a little bit. Thank you. Perfect. And then with the bell. Perfect. Okay. Now, grandma's pillow. Oh, maybe just one. How's that feel?
Good.
Okay. All right. So now I am going to cover you up here, and then I'm just going to bring this down. And I just want to take a look at your abdomen now, okay? All right. Just looking at the contour and the symmetry. I'm going to look at it from behind. I have really good lighting here, so. Okay. So from behind, I also see same thing. All right, and then can you kind of take a deep breath and hold it? Good. All right, perfect. Thank you. You can let it go. Sometimes when we have like a hernia or something, when you take a deep breath like that, you can see things.
Okay.
All right, so before I kind of listen to this, I do want to just check your pulses, okay? And then I'll listen to your bell sounds, I'll listen to some vascular sounds, and then we'll kind of keep it moving. So I'm just going to do this here. You can just relax. Good. I'm going to place down, sorry. Awesome, thank you. Good strong pulses. That's what happens when you're going to help you. Okay, awesome. And then I'm just going to uncross. Perfect. Perfect. It's so crazy how you feel so good. Usually, like in hospitals, you don't. Okay, beautiful. Thank you so much. All right. See how hungry you are. All right, now I'm going to take a listen to vascular sounds.
Good.
I don't hear any noise or any sounds like that. All right. So now I'm just going to percuss kind of 9 different areas on your belly, okay?
Okay.
So I do have to pull these out just a little bit more. I'm so sorry. In here. All right. Here we go. And start. You see how it's, you hear the difference?
Mm-hmm.
Good. Okay, sorry, I didn't mean to put too much pressure. I'm just gonna. Any pain?
No.
Tenderness? Okay. Alright. Alright, thank you. Now we are going to. Alright, so now I'm going to have you sit up and we're just going to do your leg neuromuscular and then we will be all done. Thank you so much. I appreciate it. Okay, so what we're going to be doing is going to be a series of things. They're a little bit silly, but if there's any discomfort or pain at any point in time, just let me know. We'll kind of adjust accordingly, okay?
Okay.
But this will be a really good session to kind of see how. Okay. All right. So we're gonna start with putting your hands on your laps and kind of just kind of going like this and then going faster and slower. Good. Awesome. And then can you bring your heels kind of from your knee down your shin from one foot and then the other. So kind of like this and slide down, like this and then slide down, and then this and slide down. Good. And I'll do it a little faster. Good. Awesome. All right. And then now, all right, so then I want you to close your eyes. Okay. Sharp or light?
Light.
Or dull, I guess.
Light. Dull. Sharp. Dull. Sharp. Sharp.
Okay, and then put your fingers out. Perfect. And then close them again. No, like, close your eyes, I'm sorry.
Oh.
And then dull or sharp.
Dull. Sharp. Sharp. Dull. Sharp.
Okay, good. And then keep your eyes closed. Now we're going to do your toe.
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp.
Okay, I think I'm having too much fun. All right, and then with your eyes closed, you're gonna tell me if I'm moving your finger up or down. So I'm gonna just lift it up a little bit. Okay, so you're gonna tell me up or down.
Up. Down. Up. Down. Up. Down. Up. Up. Okay.
All right, so it's gonna be your fingers and your toes. Just a heads up. What
And
finger?
middle finger
Okay.
and my thumb
Good.
and my big toe and my pinky toe
Good.
and my other pinky.
Guys, and then I'm gonna check your reflexes. Okay.
Okay.
All right, so then we'll stand up. Okay. All right. So we are. So for the hand sanitizer. Okay, cool. All right. So I'm going to just feel here. Flex for me like this. Okay, good. All right. Now relax. All right, and then relax fully. Good. 3. Okay, good. And now we're in this one. Just relax for me. You can actually rest it on. Perfect, even better. Try 1, 2, 3. Do it again. 1, 2, 3. Perfect. Okay. Now we're gonna do your biceps. We're gonna go here. Just gonna feel this groove and then okay, good. All right. Wow, you're like really relaxed. Okay, ready? 1, 2, and 3. Good. Let's do it one more time. Okay. Good. And then okay, wow, it would have been such a great that. Thank you so much. We're done. All right, now I'm gonna have you stand up for me. I'm gonna stand up again. Okay, so close your eyes and kind of keep your hands still to the side. Good. And I see you kind of wobbling over. Good. All right, so we're gonna turn around this way. I'm gonna have you walk normal. On the way back, you're gonna do your heel to toe, and then I'm gonna do walking on your tiptoes and walking on your heels. Okay. All right, so go ahead. Walk normal this one. Perfect. Now, perfect. Awesome. Heels and tiptoes. Oh, even backwards. Okay, girl. Okay, perfect. And now we're just going to have you can use this for support. Perfect. Yeah, shoulders. And then kind of bend and bend. And then put your hands resting and then kind of bend. Oh, sorry. But this way, but don't bend forward is what I'm trying to say. So just kind of, good. This way. Good. And then kind of reach for your toes without bending your knees. Good, good. I'm just going to look at your spinal process here. Good. Make sure you're symmetrical. Okay, good. All right. And then hands on hips again. And this. And then kind of go out, in, and then back. Good. And then again, this one to the side. And back. Good. Awesome. Okay, thank you so much. This all looks really great. Okay, you can sit back down. I think we're all done now. You're taking a seat. Have a drink of water. Thank you so much. Yeah, thank you.
Thank you.